Hello, this is Catherine Boyle from Key Ministry. I'm here to talk to you today about the role of a mental health liaison in your church and what that individual will do in the first year of implementing a mental health inclusion strategy in your faith community. This video was designed to help you envision what a mental health ministry might look like at your church. Now, you definitely don't need to do everything presented here or with any of the other information on the Key Ministry website about mental health ministry, but consider this a template as you are implementing your own mental health ministry inclusion strategy within your church. These are some of the things that can be done by your church. Now, as we're going through the presentation, there are three important assumptions that we have made that your church should have done to this point. Number one, we assume that your pastoral staff is supportive of launching mental health ministry. You want everybody to be in agreement on this because it's important. Number two, we assume that your church leadership has obtained the necessary approvals for creating a mental health ministry within your church. And number three, we assume that the mental health liaison is already in place in your faith community. If you haven't done those things, you probably need to go back and work on them and then come revisit some of this information. So you have the mental health liaison in place. Well, what is that position going to be doing? Well, the mental health liaison is really the face of your mental health ministry. Some of the things that the liaison will be doing is working with the church leadership to create a mental health ministry plan. You know, you're not going to get very far with your ministry unless you have a plan. It's different from some other things that you may have done because it's not only tangible things, but it's also a cultural change. But you need to have an inclusion strategy or a plan that benefits and involves the whole church. Now, even though you have gotten support for the ministry from your leadership, it's really important that the liaison go out and meet with and talk with other leaders who may not have had a role in making the decision to implement mental health strategy. Like any new initiative, it's very important to communicate and even over-communicate about why the ministry is important and continue to gain support. The liaison is going to start reaching out to the contacts in your area, the mental health contacts, whether that's your local mental health board or the local affiliate of national organizations like NAMI. We'll also contact individuals like peer support specialists who work with people in your community that have mental health needs, just to start making contacts and letting them know that your church is caring and a good place for people who have a mental health concern to come worship. The liaison is going to start figuring out, what are those unmet needs in your faith community. As you have the conversations with whether it's small group leaders or Sunday school teachers, quickly some of those needs are going to be presented. Those kinds of needs that are not currently being met should all be folded into your overall ministry plan so that your church can start meeting some of those needs. And then the liaison will also address any objections that are raised to having mental health ministry. Now, we're going to speak more directly to that in a few slides, but just know that objections come whenever there's change. And that's why it's very important to make sure that you're communicating with many people across your faith community and communicating with factual information. Now, from these activities, information gathering in the first 90 days, you're going to come up with a list of things that you can do. Again, all these things don't have to be done, but many of these things probably can be done by your church in the liaison. Now, going forward, the liaison is going to, again, be the face of mental health ministry in your church, and we'll need to just keep regular contact with the local mental health board, the peer support specialists, maybe the therapists in your area, and just to have kind of current information whenever a question or a mental health referral comes to them. Other things that the liaison will be doing is prioritizing and implementing other parts of the plan, whether it's care support, just whatever it is. There may be things that, as the mental health plan is developed, that you've learned that there is a need for support groups for individuals with bipolar disorder, for example. So if a support group is put into place, the liaison is going to need to recruit volunteers for that. The liaison can't do everything, but there's probably people from within your faith community who would be willing to help out lead support groups. Training is going to be needed for not only your church staff, but also for lay leadership. Anybody who has contact with the public, whether it's a Sunday school teacher or a preschool teacher, a deacon, anybody who touches a human in your faith community really needs to have some level of mental health training. And so the liaison will get that set up and coordinated. The liaison, of course, is going to be the point person for mental health requests, whether they're coming from the pastor or they're coming from within the faith community. Again, the person that's going to handle any objections that are coming. And then, like any good plan, you need to measure and make sure that you're reaching your goals. Mental health ministry is not so much about slapping on a program and saying we've done a good job, but it's more about cultural change. Do people within our faith community know now that yes, they can help support somebody who's having a mental health difficulty in their family? Those kinds of things, those cultural changes help reduce stigma over time, and people get the help faster that they actually need. Well, any good mental health ministry plan should really have these components. You want to have definitely everything covered in prayer. And if you have a care team that provides a meal ministry for a family that has a family member in the hospital, for example, make sure to include that family that has a child, with a psychiatric hospitalization. There may be other church and community needs that have a mental health component. Make sure that those are included in your overall strategy of meeting needs in your faith community. Communications, whether it's in the big room or within your small groups, all the communications should be consistent and factual. Small group ministry, again, you want to make sure that the leaders are trained and know what to do if a mental health need arises or is brought to their attention. And then coordinating training. Now, if you're feeling like this is a lot and that you're not sure if your liaison can handle all of this initially, start with the tangible things first. Start with prayer and start with care, because those are the things that really matter the most to people. So you might be thinking, all right, I'm still a little fuzzy on what it's going to look like with the liaison, let's say 6 months into having this role and having this plan. So what's the liaison going to do? Well, in a typical week, the pastor's going to contact the liaison. He's had multiple requests, but 2 of them clearly have a mental health component. And so the liaison's going to help work with the pastor or the individuals to get the appropriate mental health referral information for them. The liaison is going to go meet with some small group leaders to make sure that more information is gathered about any mental health needs that have been brought forward in their small groups, and set up the training that is needed on an ongoing basis for your small group leaders. The liaison will have a meeting with the local mental health board, schedule a meeting with the peer support specialist, not only to be the face of mental health ministry for your church, sending information to them, but also finding out, hey, if you have a client who's interested in a faith community, come to me. We'll be happy to meet with that person and let them know how we can support them. The liaison might be developing a new survey to understand, do people feel like they know what to do if someone comes to them with a mental health need? When all that information comes back, the results from a survey, the liaison will compile that information and put it together for the upcoming church board leadership meeting to understand what to do next in the mental health plan. There may be a family who's new to the area and is interested in the church, but they have a youth with high-functioning autism. So the liaison will schedule a meeting with them and perhaps with the youth pastor so that they can come see the church at a quiet time of the week and understand what supports are in place so that their youth will be included when they start visiting their church. And then social media updates. The testimonies about mental health recovery are very important because people with mental illness do go on to recover and have lives after the diagnosis. It's very important for people to have that, the actual face of somebody they know, to see that, that people do need some support and that faith is very important in recovery. Now, objections are going to come whenever there's anything new that's done, whether it's in ministry or in the corporate world. But it's very important to understand, what is the source of the objection? And particularly with mental health issues, oftentimes the source of the objection is fear. So it's important to be compassionate and understanding and listen to the objection, but then to answer factually about mental illness. There are lots of statistics available, whether it's from websites like mentalhealth.gov or the National Alliance on Mental Illness, that will provide factual information about mental health issues. And it's important to communicate to anybody objecting that mental health issues are already present in every church, whether it's acknowledged or not. Since this is a faith-based initiative, it's also important to provide scriptural support. Scripture is full of people who described times in their lives that in our terms would be described as things like major depression or anxiety or suicidal ideation. Some of the people in Scripture that expressed those kinds of feelings and experiences were King David, the prophets Jeremiah and Elijah, King Saul, and others. And then in more recent times, Martin Luther, the father of the Protestant Reformation, knew that he had very strong anxiety and depression. Mental illness is just part of the human condition. Now, it's important to express that mental health ministry is about valuing and affirming the image and dignity of every person, that we're all made in the image of God. And it's important to affirm that in the person who's objecting, of course, as well. And then last, it's important to help anybody who's objecting understand that disabilities of any kind, whether it's a permanent disability like somebody who can't walk, or what may be a temporary disability with mental illness, can have a very strong positive impact on your faith community. There is much that can be gained, much spiritual insight and wisdom from working with people who are differently abled, whether it's a temporary or permanent condition. So those are some things to consider when you're addressing any objections that come. And again, mental health ministry is about conditions that are things that humans have experienced throughout history. It's nothing new. Key Ministry has many resources in addition to this video. I encourage you to go to our website and check out our other ministry videos, blog articles, and resources. And also encourage you to read Dr. Gersovich's book, Mental Health in the Church. There's lots of great information in there about how you can do mental health inclusion ministry in your church. You can connect with us in various ways on social media. We encourage you to keep current on the information that we're bringing forward because it's for churches just like yours. If you need more help than what's presented in here or in our other resources, feel free to reach out to us for a consultation. Thanks so much.